Labor and childbirth. Course objectives, students will be able to verbalize why this topic is important, what are the exact stages of labor, how to verbalize what childbirth actually is, the signs of labor, and what are the different stages of labor. They'll be able to talk about the different methods for childbirth, different ways people can be induced, ways to cope with pain management during labor, the different ways that contractions are described by women in the various stages of labor, how to time contractions, and how to verbalize what exactly a patient is feeling with the contractions to understand what stage of labor they're most likely. This is an important topic because midwives, birth workers, any advocates of the birth process have to really be able to understand and express their experiences given by women, and we want to be able to give the best birth possible. So we need to be able to understand the different stages of labor, birthing positions, ways to give comfort measures, and the actual birthing process. It's essential to understand what marks the end of pregnancy, and it's one of the most common reasons people have anxiety when they're expecting their children, the unknowns of the childbirth process. The definition of labor, it's a series of continuous progressive contractions of the uterus that help to dilate the cervix and efface. It allows the baby to come through the birth canal. It can start up to 2 weeks before the labor actually occurs, and it's right around that due date. It could be 37 weeks, it could be 42. That's a normal term, healthy pregnancy. The exact cause of the onset of labor is unknown, and I hope they never ever figure it out. The mother's mind has to be in right alignment. The breasts, the nipples express certain oxytocin surges, the uterus, the baby, the cervix. There's so many layers to the timing of when the labor actually starts. And it's a process that's really interconnected with the mom, the baby, the uterus, the placenta, all as one tandem force. There's two delivery options. There's vaginal or by C. In 2015, there were 135 million babies born globally. About 15 million were born before 37 weeks, which roughly adds up to about 3 to 12% were born after 42 weeks. So most babies are being born in that term healthy stage. In the developed world, most of the babies are delivered in the hospital, while the developing worlds, they tend to be in the out-of-hospital setting with birth attendants. And intense events can occur during the labor process. It's a very strong physical and emotional process, and it's really determined by the patient's health, their age, have they had babies before? Do they have medical concerns? Do they have a good support network? Their culture, their past traumas and birth experiences. There's so many things that impact the labor and birth process, which is why I have been a midwife for 15 years and around birth for 25 years. I never get bored with it because it doesn't matter how many thousands and thousands of deliveries I see. Each one, every single one of them is slightly different. Even though it's known as name is labor delivery, but it is the ending of the actual pregnancy and transitioning into the postpartum period. It's a very common and unpredictable event as far as the core of the mom goes into labor, she has contractions, the baby is delivered by vaginally, C-section, and then she goes postpartum. But there's so many aspects of it with, does the water break beforehand? 10% of families, the water breaks before the labor starts. Most of the time it's contractions. Have they had 3 babies, 1 baby before? Are they 37 weeks versus 42? Are they planning on a home birth center, hospital? Do they have a good support network? Do they have a midwife? Do they have a physician? Do they have a laborist at the hospital? Are they delivering at a small community hospital versus a really big hospital? These things all impact the mental, spiritual, and physical aspects of how that birth process goes. So there's core signs of labor. Some people have them, some people don't. Bloody show as that cervix starts to open. A lot of women tend to get like a mucousy discharge with blood tinge to it. If there's like period-like bleeding or like a watery discharge, we definitely say that the midwife, the care provider should further check out to make sure everything's okay. Contractions are most of the time what cause the labor itself to start. It's the uterus spasming, and it'll get closer and stronger with time. Some people start out 15 minutes apart, then it gets to 12 minutes, then it gets to 10 minutes, then it gets to 8. Usually by the time they're delivering, it's every 2, 3 minutes apart. But there's some people that wake at 2 in the morning and don't get the early stuff. They just wake hot and heavy in active labor and say, I got to get to the hospital now. There are even rare people that are 7 centimeters and they get to the hospital and quote unquote say, I just feel off, and they're not contracting. They don't know they're in labor. So it's nice when they've had kiddos before because they get a sense with their body how things go, and sisters and aunts and moms and how their births have went. But first baby is on average 24 hours, and each baby continues to be about half that timeline on average. Um, if it's just it was her first baby 10 pounds and this baby's 8 pounds, it's probably going to be delivered a lot faster. If her first baby was 6 pounds and they're estimating this baby's going to be 10 pounds, she'll probably have to work a little harder than last time. So there's so many things that impact and affect the labor process and what position the baby's in. If the baby's head down, the baby's breech, the baby has a hand next to the face, the baby has a cord. Like there's a lot of things that impact the labor process goes. The water typically breaks close to delivery time. Sometimes the babies are born in the caul, which is born inside their sac. It's so rare for the water in the hospital setting to not be broken to help accelerate the process. Typically in home and birth centers, it'll be a spontaneous rupture and it's close to delivery time versus an active labor by the care provider. And it depends if they're being medically induced versus a natural labor process. It's going to look a little different for how the labor is going to go and how ready their body's going to be. Different stages of labor. The first stage is traditionally the early stuff, the latent phase, milder contractions. They range from 15 to 20 minutes apart. It could be a half hour. On average, first baby, it's like 10 to 12 hours, and then it cuts in half each kiddo. It's typically the time that the patient doesn't go to the hospital if they're planning on a hospital delivery or a birth center. Usually the doula birth photographer may come to their home in the early labor, but usually like the midwife for a home birth, or if depending on the doula and the photographer's goals with where to get pictures, they may come to the home birth center or hospital in more active labor. The baby is actually coming through the birth canal. It's also called the stage of expulsion. So a lot of women in the first stage, that early active transition stages, if we can get them to second stage, it's pretty rare people will get epidurals or pain management because they're close, they can push, they're almost done. The third stage is when the baby is already out and now we're delivering the placenta. Sometimes it happens 2, 3 minutes after delivery on its own, and sometimes it takes a half hour. Once you start getting past a half hour, you always start wondering about additional concerns and bleeding. I would say the average is 5 to 7 minutes, but it just varies greatly. There's different kinds of childbirth methods. Most people are familiar with vaginal deliveries. About 2/3 of the deliveries in the US are vaginal. It ranges between 20 to 50%, depending on the hospital and the practice standards. It's hard to know exactly when a woman will go into labor. Term healthy is 37 to 42 weeks. A lot of people are delivering 37 or 39 to 40 weeks because of all the inductions, whether it's medically needed or socially needed in the United States. The nation's largest OBGYN organization, ACOG, recommends that women plan for vaginal delivery unless there's a medical reason for the C-section. A C-section is a delivery through a surgical incision in the mother's abdomen and the uterus. In certain situations, a C-section is scheduled in advance, a repeat, breech presentation, twins, etc. But many times it's done in response to an unforeseen complication where a vaginal delivery isn't the best route for mother and or vaginal birth after C-section. I wish we had more people doing this route, depending on how many children they want and the resources they have available. A lot of birth centers, home and small community hospitals just don't even offer VBACs based on liability, access to in-house anesthesia, resources, etc. And it depends on the reason that you had a C-section the first time. Did you have a 6-pound baby and push 5 hours versus you had heart tone issues? You'd had 2 successful vaginal deliveries, then you had a baby that had heart tone issues, a placenta problem. You'd be a great candidate to do a vaginal birth after C-section. So it is possible. It's estimated 75% of women would have a successful VBAC if they tried after their last section. Vacuum extracted forceps, these are assisted deliveries. I would say vacuum is more common than forceps, more because of just the training across the country. It's kind of a lost art to do the forceps as much. And it's used only in situations where the baby is low enough in the pelvis and minutes matter for the baby to be delivered and expedited faster. The cervix is complete, the baby's low, there's a cord, there's heart tone issues, there's bleeding. Otherwise, they would just do a C-section. For the stages of labor, there's 3 components to stage 1. The initial latent phase, that's that up to 4 to 5 centimeters. Active phase, depending on which books you read, it's 4 to 6, 4 to 7. Some of them are even saying active for first-time mothers doesn't even start till 6 centimeters to keep them at home as much as possible. Transition is the part where many people will decide to get pain meds. It's the most intense part of the labor with the contractions. It's usually the shortest phase. That's at 7 to 9 centimeters before the mom starts pushing. Stage 2 is the actual cervix is all gone and the baby is actually delivering. The more babies you have, traditionally this goes faster, but it's not always 100%. We talked about the sizes of the babies, the positions of the baby posterior, facing at the ceiling, sunny side up. Is harder to push out than one in a traditional normal position. When her last 3 babies were 6 pounds and this one's 10 pounds, she has a hand. The baby is asynclitic, where the head is kind of cockeyed a little bit. There's just extra variables that can impact the pushing process. And then stage 3 can be minutes after the delivery of the baby, or it could be 30, 40 minutes after delivery, and that's the actual delivery of the placenta. Reduction labor, it's one of the most common reasons that people are induced is because the mom and baby has risk. In the US healthcare system, we do a lot of social inductions, and I have really mixed feelings about those. I get we have professional burnout and convenience and the challenges that a mom wants to know she's uncomfortable and she wants to have this person deliver because there's a big group practice and her favorite provider is on call, or it's a small community hospital and there's one doctor served the community for 40 years and really likes to have their weekends off. So there's lots of inductions on Monday, Tuesday, Wednesday, and rarely any labors that come in spontaneously. So the goal is you should be doing an induction for medical reasons, and people are getting sicker and sicker with obesity, hypertension, post-COVID. There's just, people are getting sick. And it breaks my heart to see less and less normal, healthy people anymore. Labor can be induced by various methods. They can do cervical ripening with prostaglandins. They can do Foley balloon. They can do Dilapan. They could do some stripping, sweeping of the membranes. There's even some more natural ways with the sperm has prostaglandins, sex itself. There's certain situations where they'll break the water if she's had babies before, the baby's low, the cervix is open. I would say most of the time, if they've had babies before and the cervix is thin and open, they traditionally start with synthetic Pitocin, oxytocin to cause contraction. Pain management options during labor. Some people want more natural approach, which would be like the water, the shower, hypnosis, meditations, labor support, birthing balls, motion, massage, music, a calming environment. But if you feel like they need something a little stronger during labor, quite a few options. There are the analgesics, there's anesthesia. Some places like their Nuvain, their fentanyl, their morphines, IV pain medicine. Some places have nitrous, which is like that laughing gas that's self-administered by the patient. Epidurals, I would say, are the most common option that really limits mobility, but it gives the most pain relief for the patient. Um, I did my thesis on informed consent with epidurals, so I have a deep passion for epidurals and the pros and cons of choosing this option and the timing of getting it. For some people, it might be a good thing to consider, and for some people, it may not be a good option in management. Um, just going back to the basics of what are labor contractions, they're periodic tightening and relaxing of the uterus, the largest muscle in the woman's body. It's triggered by the pituitary gland to release a hormone called oxytocin that stimulates the uterine tightening. It's difficult to predict when true labor will actually occur for people. There's probabilities. And some people describe it as tightening in their lower abdomen, in their back. Some people Everybody feels it kind of in different places, but it's kind of waves that come and get closer and stronger with time. Others have described it as pressure, pain, all in their back, all in their rectum, up high, but most of the time it's low and in the front as the baby comes down. These are ways that you can learn how to time contractions you're doing from the beginning of one contraction to the beginning of the next contraction is the frequency, and then the length is beginning of one contraction to the end of a contraction. So I know some people get apps and they get really in detailed with it all, but the whole point is it's going to get closer and stronger with time. Um, but yeah, you can write it down for a little while, but I think some women don't even go into labor because their brain will not turn off because they're counting and timing their contractions and using so much energy to focus on counting and being objective versus just letting the birth happen. Everybody's different how they describe them. Some describe them as period-like cramps. Some people say they're severe gas pains. Some people describe it as um, tightening, especially if they didn't know they were pregnant. They come in with abdominal pain, flu-like symptoms, intestinal issues, and each person's different. So if you have a history of Crohn's disease or irritable bowel syndrome, you're probably going to be more sensitive with your intestinal system and diarrhea um, compared to someone else that doesn't have digestive issues. Visualize that wave. The body is tightening and then relaxing. It's the most intense at the peak of it, and then you can ride the wave down. So most people are using their coping and pain management methods while they're riding the wave up, and then as the wave's coming down, they're kind of slow, deep breathing and relaxing. And then you almost feel back to normal in between the contractions. So there's these periods of you work hard and then you relax, and then you work and you relax. So as an overall conclusion, labor is a series of continuous progressive uterine contractions that aid in the opening and thinning of the cervix. It allows for the baby to be born through the birth canal, the vaginal opening. It can occur to 3 weeks before the due date, all the way up to 2 weeks past the due date. But I would say most people in today's society, it's between 39 and 40 weeks because of all the inductions that we have going on. There's many different ways for pain management, a lot of birth, different settings. And so it's important just understanding this birth process to know the stages of labor when someone is in labor, especially if you're a birth worker. You want to make sure you're advising them when to come to the hospital or birth center at the right time, variations of normal, concerns. If you're a doula, a birth photographer, you want to make sure that you're supporting them in that early active labor and getting lots of photos, getting good labor support, being there for the timing of when they want the pictures, when they want that labor support.